If your baby spits up a lot, seems uncomfortable after feeding, or cries shortly after meals, you're definitely not alone. Reflux is one of the most common concerns parents have during the first few months, and many parents ask the same question: is there a better formula for reflux babies? Today, I want to walk you through what reflux really is, what usually helps, and how parents often choose a formula that feels gentler for their baby. First, let's talk about reflux itself. Reflux happens because a baby's digestive system is still developing. The muscle that keeps milk in the stomach isn't fully mature yet, so milk can easily come back up. For many babies, this is normal and improves with time. But even if reflux is normal, that doesn't mean feeding has to be uncomfortable. One thing we see very often is parents feeling pressured to keep switching formulas. They try one formula for a few days, then another, hoping something will fix everything overnight. In reality, frequent switching can actually make digestion harder for some babies. That's why choosing a gentler option and giving it time often matters more than constantly changing formulas. So what types of formulas do parents usually consider for reflux babies? Let's start with goat milk formula. Many parents choose goat milk formulas because they tend to be easier to digest. Goat milk naturally forms softer curds in the stomach, and some babies seem to tolerate it better than standard cow milk formulas. Parents often tell us that spit-up feels less frequent, and their baby seems more comfortable during and after feedings. Another option parents look at is anti-reflux, or AR formulas. These formulas are designed to thicken slightly once they reach the stomach. The idea is to help the milk stay down better, which can reduce visible spit-up. AR formulas are often considered when reflux is more frequent or noticeable. Some parents also choose gentle European formulas. European formulas tend to focus on simpler ingredient lists and strict production standards. For certain babies, this combination feels easier on digestion and supports calmer feedings. It's also important to talk about what not to do. Overfeeding can make reflux worse. Feeding too quickly can make reflux worse. And switching formulas every few days can sometimes do more harm than good. Small changes, like pacing feeds, holding your baby upright after feeding, and choosing a formula that feels gentler, often make a bigger difference than parents expect. Of course, there are times when reflux needs medical attention. If your baby isn't gaining weight, seems to be in pain, refuses feeds, or you notice forceful vomiting, it's important to talk with your pediatrician. Formula can help with comfort, but it's not a replacement for medical guidance when something feels off. The most important thing to remember is this: reflux doesn't mean you're doing anything wrong. Many babies outgrow reflux naturally, and with the right feeding approach, parents often notice things gradually get easier. If you want to learn more, we've put together a full parent guide linked below, where we explain reflux in more detail and share formula options parents often explore. Thanks for watching, and I hope this helped make feeding feel a little less stressful.